my epiphany, I'll talk a little bit about it, but it really wasn't that hard. It was the idea that if you have an LDL cholesterol that's out of control, you got to do something about it. And looking into the literature was really eye-opening because most of us in cardiology are not reading the American Journal of Clinical Nutrition, and there's data out there that we should know about. And it's always fun to come to a wonderful institution. It's also interesting to talk in Texas about this, which I've done a couple times because it's sort of counter the culture of Texas to talk about plant-based nutrition. But even though I am going to talk about plant-based nutrition, what I really want to talk about is taking the die out of diet. It's, I try to make it into a cutesy phrase that people will recall, but I'll spend most of the time, and we'll talk about eating patterns, micronutrients, but mostly everything that correlates with mortality, and that's because that's really where we could do a whole lot better. The burden of heart disease, looking around the room, I don't have to tell you what this is like. I've been talking for 1 minute and 23 seconds, I'm sure, so 1 American has died of coronary heart disease. It's been with us as the leading cause of death since 1918, and I'm sure everyone is aware of that. What you're also, we've been talking about this for a long time. This is New England Journal of Medicine 2012, and they were showing us all the things that we've done to reduce cardiovascular mortality. And the only thing they missed, as far as I'm concerned, is right about 1973 when the shoulder starts to go down. That was the advent of nuclear cardiology, right? Okay, and so we've been on this downward trend ever since. But I've always felt that what we've been doing, if you look at all those therapies, everything from statins to bypasses to stents and grunts that coming to Emory, et cetera, is that we've been mopping up the floor instead of turning off the faucet. We haven't really turned ourselves to prevention. It makes big business. We're going to be, very soon, 18% of the gross domestic product in healthcare, and cardiovascular is the #1 healthcare expenditure in this country. And so shouldn't we be doing something to prevent some of the events instead of dealing with the events after they occur? And then there's this. I'm not sure everybody heard that. Actually, I'm sure everyone here heard the news that 2015 had nothing to do with me being president of ACC, I hope. And it was the first time in over 40 years that the cardiovascular mortality rate did not go down. It actually went up. It went from 167 per 100,000 to 168.5 in 2015. And so that nadir of 167, if things do not change, we may not see that again. Everyone's got their speculation about what it is. A lot of it actually has to do with diet and lifestyle. So quaint statements like the chair is the new cigarette. That's probably very true from an epidemiologic point of view. But a lot of it is convenience food and the choices that we make in this country that are not heart healthy. So I do want to emphasize this more and more because lifestyle can turn this trend and send it back the way it's supposed to go. As I mentioned, with a lot of help from Bill Zogby, we are an international organization, and so I had the pleasure as president and really even still now on the presidential team of traveling all over the world and talking about cardiovascular disease. And we realized that we have exported the American lifestyle and American companies, whether it's fast food restaurants or and just sort of less agrarian societies all over and more convenience foods, and cardiovascular disease is now #1 globally. And if you look at the numbers, they don't look good. And a lot of the cardiovascular deaths are not in the, the rich folks eating the king's food, that sort of thing. It's really the low and middle income countries where the risk factors are just taking off. So I like to look around the world just for a moment at some of the examples of how things could be done differently. If we can, because there are a couple of good examples. One sort of starting in a bad place and going to a good place, and then some where they've actually been good all the time. And couldn't we model some of that? So let's talk a little bit about that. I remember being in medical school in the late 70s, and they would throw up the cardiovascular stuff, and United States was not the #1. The #1 heart disease place was actually Finland. We used to joke that didn't want to go there, that's where the finish line is. So the idea that they had such a high coronary mortality really got to them. They were looking at the cost in terms of lives, the cost in terms of healthcare. Couldn't they do better? And they actually sort of heard this idea about cholesterol filling up arteries from Ansel Keys in 1970. And they decided to just start it in one little area in North Karelia, and then try to move it around the country. And they actually did a fantastic job. It took a while. Look at this. This is actually just them emphasizing, let's do less butter. Let's put more vegetable oil, or no oil at all. And it took a number of years to get that ingrained into people, but drop it did. And then what was the result? Serum cholesterol, okay, dropped significantly. They also did smoking cessation, okay? And what did they do? They cut the cardiovascular mortality by about 50%. They emphasized cereals and vegetables. I don't know much Finnish, so I don't know what it sounds like, but I've heard it described as incentivizing, you know, those farm subsidies that we do for things like high fructose corn syrup. Yeah, well, they were doing it for fruits and vegetable growing, changed from dairies to berries. And so reducing animal products as well as smoking really had a big impact. Well, they were modeling after a lot of the countries that have actually done some of this already, did it naturally, and so it's always worth talking about sort of the epidemiology of the blue zones. Many of you have heard of it. It's Dan Beutner was sent out on a mission by National Geographic to find out how to live to be 100. I'm sure there was some editor that was aging and was very interested in longevity. And the Blue Zones was not a magic, you know, listening to Dan, he says that he would go through everyone's data, and whenever he had a big map on the wall, and every time he found one where people consistently lived to 100, he just circled it with a blue magic marker and then called it this Blue Zone. So everybody thinks it's has some more meaning than that, but it doesn't. What he found out is that there are several places, and the Okinawans would be one of them, ones that you really could emulate. You don't have a lot of obesity, hypertension, diabetes, and very little cardiovascular mortality. The diet is full of beans, particularly soy, a lot of vegetables, very low in animal products, and low in refined sugar, and I'm going to hit that topic several times. But everybody's moving and working. And obviously, the concern is that it's changing, even in Okinawa, that life is becoming less agrarian, more convenient, and that this will change over time. But they've had a long history of doing this. And if you compare other places, the other blue zones in Greece and even the United States, where I'll talk a little bit about the Loma Linda experience, you have a lot of compilation of lifestyle factors that make perfect sense, and I think they're lessons for us all. So number one, don't eat so much, okay? Cut the calories. When your stomach is 80% full, that's enough, okay? Eat the smallest meal of the day. I'd love to see a randomized trial, but eating it early in the day and late in the afternoon, late in the afternoon or evening. Eating mostly plants, especially beans. I've got a lot of data that supports that, and eat meat rarely. I'm taking Dan's words carefully, but I always have to interpret them in an American audience. That does not mean don't cook the meat very much, okay? It means, okay, eat it infrequently, okay? So once a week at most. If talk about the Loma Linda, I had the pleasure of being there and giving a grand rounds and talking to these folks who have been really talking to Gary Fraser, the lead author, you know, blessed with this data of a religious group that preaches an ovo-lacto vegetarian diet, but doesn't enforce it, which means that he's got all these different groups that he can follow and find out what happens to them. And so, so they have a lot of different diets, and the numbers are small in terms of percents for some of the diets, but the population is so large that he actually can reach statistical significance in just about everything he's looking for. And so we all could sort of characterize ourselves into one of these 5 patterns, and then the data that I'm going to show you will apply to you, more than likely. You know, comparing the standard American diet to just cutting the meat a little bit, to cutting all the beef and pork, et cetera, and only doing fish and dairy, eggs, the so-called pesco-vegetarian, only eating dairy products, and then eating none of the above. And probably the first really important work that sort of underpins the cardiovascular disease is looking at obesity, diabetes, and hypertension. And you could pick whichever one of these you want, but I would say that the most important in our, at Rush, we have a lot of different people that we see, people coming from all over the world. We have CEOs, but we also have a community to serve. And if you go a little bit to our south, it's mostly African American and Chinatown. And if you go to the west, it's more Hispanic. And so for the Hispanics, it's the diabetes. For the African Americans, it's the hypertension. To be able to tell them that if you just cut it down a little bit, we can drop your incidence of diabetes by 25 or 23%. Same thing with hypertension. Go a little further, just dump all of the animals other than fish, and you get about a 50% reduction in diabetes, 40% reduction in hypertension. Keep going, keep going. If you go completely vegan, you've got a very low incidence of diabetes and hypertension. I've had the vegans look at this slide and say, well, why would a vegan ever develop hypertension or diabetes? And that's just one of the statistical issues of doing observational studies. A person is a vegan if they turned vegan last week, they're considered a vegan. And so you're never going to get perfect data, randomized, free-living populations to do exactly what you want and stick to it. But the pattern is very clear: less obesity, less diabetes, and less hypertension. And those three are probably very highly intercorrelated. Is risk factors enough? Really not. It's particularly with my subject today, taking the dye out of diet. So they did actually publish a mortality study and really clearly show it's harder to reach statistical significance, much easier to find incidence of diabetes and the like, but waiting for folks to die so you can reach statistical significance isn't the fun part. And so, but if you take all the non-vegetarian versus any of the vegetarian patterns and add them up together, you have a very strong, particularly in men, a very strong signal that you can reduce ischemic heart disease deaths and overall cardiovascular death, as well as all-cause mortality. I'd like to spend a little bit of time on blood pressure. Everybody's probably very familiar with the JNC ain't controversy, and several years ago coming out with sort of rogue guidelines, and the difficulty that we had trying to rein that in. And ACC/AHA is putting together the guidelines. They're almost done. So hopefully by ACC 17, you'll have a new document. It won't be JNC 9. It'll just, NIH just asked us to just stop calling it JNC. But one of the major things that we will talk about without giving anything away is that we all should be working on lifestyle things. It's part of our guidelines already. We have lifestyle guidelines out there. We have lipid guidelines. It's a basic principle that we should do everything we can to prevent these diseases. And one of the things that has more data than it had in the past is the idea of plant-based nutrition. I hear people saying that, no, diet doesn't matter. It really does. And there's a lot of data in this regard. There are some studies that I would look at and question some of the methodology, but for them, if you add them all up together, you have the weight of the evidence is strongly in favor of lowering blood pressure by plant-based nutrition. And so this was a nice meta-analysis published in JAMA in 2014 that certainly agreed with that. And you start wondering, how consistent is it? I can tell you as a practitioner of it, and I'm usually taking people with three-vessel disease who are either revascularizable or they don't want to be revascularized, and trying to make a big change in them very quickly with diet. And it turns out that one very consistent finding is that the blood pressure falls. And so I actually had to do a deep dive. Why is it? And even my own blood pressure, when I went vegan, went from 128 to 104. And I'm saying, what is going on here? I think I'm eating more sodium than I was before, and these veggie dogs and the like. And it turns out, according to Jeremiah Stamler, who's at Northwestern, has been doing this for a long time, looking at micronutrients, that glutamic acid intake, which is the predominant dietary amino acid in vegetable protein, is very antihypertensive. And there may be other reasons like high potassium levels, high magnesium levels, so-called DASH diet, that eating more vegetables and less animals. It may be the effect of saturated fat. It actually may be, and in fact, if you look at our guidelines, they try to distinguish dietary effects from obesity effects. I'm not sure we have to do that, but that's the way we did it when it was published in 2013. And so you may have a wide variety of things that come together to change blood pressure. So it may be that that controlling the weight has such a big effect, and that is something that we certainly can do with more of a whole grain diet approach. And there's pretty good data that within changing the weight, you can change the blood pressure as well. So I won't spend too much time on it, but I just want to, for some of these details that I'm going through fast, I put the slides on the desktop, so you can just come on up and grab some and take a deep dive. The point of this particular article that was published just a few weeks ago was that you had particularly diastolic blood pressure, threefold greater improvement if you were consuming a lot of whole grains as opposed to refined grains. So that's an interesting concept that may be, that the protein is more whole, or there's other things in the plant-based diet. So why am I focusing on hypertension so much? Because we are all in this crisis. I talked about, that very soon we'll be talking about 18% of the gross domestic product of the United States being spent on healthcare. And if you make projections over time, the population is aging. And every time we do a TAVR here at Methodist, you're extending someone's life, you're increasing healthcare costs. Obviously, if you're the insurer, in the case Medicare, the best thing the person can do for you to help you out is to work until they're 65, pay their premium, and then have sudden cardiac death. It just doesn't happen as much anymore. And so the aging population is very expensive to take care of because they're not well. They're older and they're not well. And so if we look at where is Medicare spending money, interestingly enough, they're spending a lot of it on hypertension. So 58% of the Medicare beneficiaries actually have hypertension. I tried just taking the best data that I could find just to cost it out. It turns out that about $131 billion for hypertension, including treatment of complications and hypertensive medications, hospitalizations, et cetera. So it's about 30% of all the Medicare expenditures. If you extrapolate the growth that we're expecting over 2020, we're talking almost $300 billion, and as we maintain that 30%. Now, suppose you took that Loma Linda data and everybody went vegan, right? And you somehow got people to do that. And you reduced the incidence only by 75%. The savings to the budget would be absolutely about 23% of the entire Medicare budget. So I want to say that every time we're able to make a change in lifestyle, I think it's our patriotic duty. Okay, all right. Switching to talk a little bit about caloric density, I don't want to talk just about micronutrients and dietary patterns because the obesity epidemic is a major issue for us. And it seems to be getting worse. It's generating the diabetes. It is one of the things that folks are talking about in terms of why our cardiovascular mortality did not go down in 2015. And this was put out by Juliana Heaver. She's a registered dietitian, and it's just very visual. What does 400 calories look like? Okay, she actually works with one of those vegan gurus. There's a lot of them, or several of them, and they can't agree on anything. But I agree with all of them because there's no animals, and they all have varying degrees of success with whatever they're doing. But John McDougall, you could look him up. He's kind of unusual, and he's always talking about eating. You must eat starch. Well, why does that even work? It's probably because there's no animals in the diet. But the fact of the matter is, he coined that phrase, the fat you eat is the fat you wear. And it's actually pretty true. And this is why. If you're eating oil, you're getting a lot of calories. You don't get necessarily the satiety. Similarly for the animal products, chicken or beef, but if you're eating 400 calories of vegetables, you actually do get full. It may not last as long, so all the vegetarians in the room know that you get hungry again, but that hunger is probably actually a good thing. There is data, though, that getting the calories down, and plant-based nutrition is one way to do that, is actually good for you in terms of life, sleep, and sexual function. This was published just a few weeks ago in JAMA Internal Medicine, so I had to grab it and throw it in here. Looking at people in a randomized fashion, and actually one of very few randomized clinical trials that actually showed that you could actually lose weight, and if I blow it up, you have less depression, that goes against what people would say, you know, if I can't eat the stuff I want, I'm going to be depressed. It turns out it's not true, okay? And improvement in sexual arousal and function is something that everyone talks about in the vegan community, so I won't go further with that until we do urology grand rounds. I'll come back for that one, okay? But when talking about dietary patterns and recent publications, this is one that really got to me as a person growing up on the south side of Chicago. It really is a southern area in terms of where people came from and how they eat. And the Regards trial, I encourage you to look at what they're doing. Any budding academic fellow, just how to spend a couple of minutes on the Regards website. You won't find this study. Why? Because they've published like 70 things after it, but this was a relatively recent publication that showed this. This Kaplan-Meier plot for survivorship. This is survivorship without cardiovascular death, myocardial infarction, or stroke. And what it showed is that the Southern diet is actually a euphemism. What they're really saying is the African American diet. A lot of sweets, sweet tea, fried foods, fried chicken, a lot of organ meats, you know, whether it's chitlins, you know, liver, kidney, ham hocks in the greens, whatever, all of that high saturated fat, high cholesterol, high sodium is really associated with cardiovascular havoc, we should say. And it's interesting that they didn't have in the Regards trial much in the way of plant-based nutrition. What they called plant-based were people who ate 2 or more vegetable servings per day than the rest of the group. That was plant-based. Okay, so it's interesting. So why is it that you have such difficulty cardiovascularly? We've actually had data on this for a long time. This was actually Robert Vogel, 1997, looking at the effect of the high-fat meal. I was really impressed that there isn't a lot of high-fat food back there, so nobody's falling asleep. Why? Because when you eat a high-fat meal, it actually causes endothelial dysfunction. And it happens acutely. It lasts for about 6 hours, at which most Americans, what do? They eat again, okay? And so another high-fat meal. So it makes it tough on blood flow. But it's probably not just blood flow. It probably does have to do with the development of atherosclerosis and hypertension and the ravages therefrom, so that you get this 30% higher risk of stroke, 50% risk in kidney disease, as well as a 56% increase in cardiovascular death. And so that Southern diet is something that, sort of reading that, coined that phrase, don't let your culture hold your heart hostage, and actually pulled that out at ACC. When I first did the graphic, it had a hamburger holding a gun to the heart, and then I realized in Chicago I had to take that part off. So okay, let's talk about sugar. I'll try not to get too sad during this and keep it light, but this is a very sad episode that many of you heard about. All of you knew this part already, that if you're eating a lot of sugar, you get more obese, you get insulin resistance, hypertension, et cetera, okay? What you may not have seen is that we have, how many nurses do we have here? I just want to say thank you for being a nurse, okay? And hopefully you're participating or supporting the Nurses' Health Study, because we get so much information from them about patterns that improve lifestyle. And so I encourage you all to look at this publication from a few years ago that had so much information that was going to predict how people would do if they would just change things. So there's this big table called a competing risk analysis. So you're looking at mortality and looking at things that, that correlate with mortality. The biggest correlate with mortality is aging, of course. The second biggest was actually diabetes. But if I go to the upper right-hand corner, you see just what we've been talking about. You eat animal products, you get cholesterol. You eat vegetable products, you don't get cholesterol. And so it turns out eating a meal with cholesterol actually increases your mortality 17%, if that's your dietary pattern. Doing fiber instead decreases it by 16%. But glycemic load actually seemed to be numerically, the point estimate was higher than cholesterol, which was very curious because we were all taught that saturated fat and cholesterol, those are bad for you, and that sugar is okay if you don't do it to excess and become obese. But then there was this a few years later. And I have to admit that I was one of those sugar vegans. You know, you get satiety by eating Oreos. I'm sitting there doing clinic notes in the middle of the night, and I look over, finish the notes, and boy, the Oreo package is gone. And so, as it turns out, yeah, because Oreos went vegan about 10 years ago. Okay, but you know, that doesn't mean it's healthy. And so, fortunately, in 2014, I saw this study, stopped it immediately. It's the ability to stop on a dime is actually very helpful to your health. And so, reducing the amount of sugar in the diet can actually lower mortality, at least according to that. And then there's this. You probably saw this a few weeks ago, and this was very sad. The idea that you could buy off a chair of a nutrition department at an Ivy League school for 50 grand, essentially. I guess one of the lessons to learn from this is that if you're going to do something nefarious, destroy the documents. Okay. But someone, Kristen Kearns, actually found boxes of these documents documenting how these payments were made, essentially to shift the blame from sugar to saturated fat for cardiovascular death. And so we're still reeling from that millions of lives later. And so we do need to focus not just on cholesterol and saturated fat, but on sugar content as well. There's more data. It was interesting, I happened to be in Europe, so I saw this come up, and I didn't see much coverage in the United States, but some people say they did hear about it a few weeks ago. It's in the European Journal of Endocrinology. It was published right after the sugar at Harvard thing, talking about sweetened beverages. You do 2 of them a day, and you end up with diabetes at double the clip of the people who are not doing the 2 sweetened beverages per day. The JAMA article about the Harvard issue had an editorial that had one of the most insightful. I actually took this and put it on my Twitter page, I think, or Facebook or something. I mean, it was like, I was very impressed with this. This is comparing kind of saturated fat and sugar intake by country, and then putting what the cardiovascular mortality is like. And you could see, for anyone from Japan, the culture is to not eat a lot of either one, and you end up with this incredibly low cardiovascular mortality, and it goes up to most of these Western countries. Finland, it's high, but going down. It used to be way above us. The United States, very high. And so we really can change this, but we have to get the word out and let people know that despite what they're seeing in terms of marketing in this country, these things are very dangerous. Okay, let's talk a little bit more about saturated fat. Did I really do that? Yeah, I did. Okay, all right. This actually was published not a few days ago, a couple weeks ago, in terms of looking at United States population. Of course, it got accepted into the British Medical Journal. Okay, okay. You know, I think Oprah was sued in Texas for saying that you shouldn't eat animal products, and so I think people are very careful where they publish things. Anyway, this was 2 prospective long-term studies, and of course, it was the doctors and the health professionals follow-up study and the nurses' health study, again, talking about coronary heart disease. And the bottom line is that, yes, indeed, it's not just cholesterol, it's not just sugar. High intakes of saturated fat increase coronary heart disease. The really important thing that comes out of this, I love their little editorial page. You know, we do it at Jack with Val Fuster giving an auditory comment, but to have a sort of a takeaway box is kind of a cool thing. And the bottom line is you should eat more whole grain carbohydrates, decreasing the amount of saturated fat in the diet that comes along with eating animal products. Okay, how about high protein? You hear this all the time. Let's talk a little bit about protein. Everybody recognize this gentleman? That's Atkins, right? Okay, and you see stuff like this. Is it real? Oh, absolutely it's real. Okay, and so I remember a friend of mine going on the Atkins diet and losing weight, and he gave me the book, and I said, this book is I don't know what's in this book, but I can tell you, if you don't eat any carbohydrates and you only eat fat and protein, you're going to get ketotic, you're going to feel terrible. And I opened the book, and guess what it says? you get ketotic and you feel terrible. And you actually, it lowers the amount of caloric intake, and that makes you lose weight. So some of them are dramatic, but what has happened since then, you may be aware, is that his estate, after he died, he actually did have a heart attack, and he died separate from that. People speculate that he had a second heart attack. That there's lawsuits that he knew that this was a damaging diet, and before the publications came out, this was one almost 10 years ago. That talked specifically about that diet with a 22% increase in mortality if you use that dietary pattern. One that's a little more recent, from 3 years ago now, said that it really isn't the low-carb approach. It's the animals in the low-carb approach. And if you did a vegetarian low-carb approach, you'd lose weight and you wouldn't have that mortality. The mortality difference that they found was 53% difference. And so it's really something to avoid. So why is it? We'll talk a little bit about that as we go forward, and I want to leave a fair amount of time for questions. We've actually had this data on red meat for a while. I mean, I know it wasn't out when Oprah was talking about it, but it's been out for a while now. This is from 2012, back when it was called the Archives of Internal Medicine. It's now JAMA Internal Medicine. And the conclusion was that if, cancer, cardiovascular disease, total mortality, all related to animal consumption, in a linear fashion, but this is sort of skewed toward the biggest slope of the mortality curve being between 0 and 1 servings per day. But still, 1 is better than 2, 2 is better than 3, et cetera. They had this interesting graph of what it is that you could do to have your nutrition without meat and what would be the impact. And the biggest change was actually nuts. For either unprocessed red meat or processed red meat, you actually had a big change in outcome. And so pretty good stuff. And then in October, we had this, and you had a lot of vegans go, yeah, I told you so, yeah, I told you so. Okay, so I encourage you to take a look at this particular article. It was published in JAMA Internal Medicine as well, talking about animal protein versus vegetable protein, and so, and mortality. And it actually was a very large trial, again, nurses' health study and health professional follow-up. And this is the graph that I show it to almost every patient who's questioning diet at this point, just so they know. There were a couple of things. I have a little time for an anecdote. We'll talk about it a little bit later. But the American College of Cardiology had a big impact on the dietary guidelines for the United States that were supposed to be 2015 to 2020. It ended up being 2016 that it was published just because there were so many people going at them. But we went at them because they said that we said in our guidelines that it's okay to eat cholesterol, and that's not what we said. But we're sort of in this locked, in this battle with the locking horns with the egg board. And the egg board was saying that there's no statistical significant relationship between egg consumption and cardiovascular mortality. And we're saying, okay, that's maybe true in some studies, but in most there really is, particularly producing diabetes. And if you're diabetic eating eggs, you had a big increase in mortality. And that was actually in the articles that they were quoting, just being ignored out of it, which was really bizarre. But I finally got some insight as to why they were saying that. So take a look, a very careful look. This is cardiovascular death, and it's all different kinds of animal protein. And eggs, very similar to fish, 12% increase in mortality, dairy, 11% increase in mortality, eggs, 12% increase, but that one doesn't reach statistical significance. And then you drop down and see that the thing that we all fear the most, based on the publications, is not just red meat, but processed red meat. It increases the heart attack rate tremendously, all-cause mortality tremendously. Eggs actually cause, the point estimate, more cancer deaths than processed red meat, which means you don't reach statistical significance because dead people don't have heart attacks. And so it's interesting that this was very instructive to us. And so the bottom line is that eggs will be cancer-causing, processed red meat, heart disease-causing, but all 6 of them categories actually result in increased overall death. So I encourage you to take a good, healthy look at it. It's This was confined to the population who had at least one risk factor. So if you're thinking this, somehow this doesn't apply to me, it doesn't apply to me, it won't apply to you until you have a risk factor. But unfortunately, for most of us in the United States, if we're doing the usual diet, we do end up with risk factors. Just a mention about nuts, because we do have sort of in the vegan controversies, you've got the Dean Ornish diet that would have it, and McDougall would have it, Furman would have it, Caldwell-Esselstyn, which I'll mention later, no nuts. Well, that's a tough one because nuts have been shown to be a good substitute. They don't, even though there's fat in them, a lot of monounsaturated fat doesn't increase plaque burden unless you overdo it. And it's been associated actually with decreasing weight, not increasing weight. However, it's still out, is the question that you have to answer is that are nuts in themselves good, or are they just stopping people from eating meat, and that is what improves things. And that's a tough one to answer without a randomized trial, but I didn't want to go by that nuts are good for you thing without mentioning that there is good data. 5 servings a week increases or decreases your mortality substantially. Okay. Let's talk a little bit about some of the molecular issues that have come up in this area. One, of course, is C-reactive protein. Everybody's familiar with it. We stopped measuring it when they stopped paying for it, but we all found it very useful because of Paul Ritker, New England Journal of Medicine, looking at these 4-pronged Kaplan-Meier plots saying that if you have a low CRP and a low LDL, that's better than just a low LDL. And if you have a high CRP and a high ADL, that's worse than having just a high LDL. And so, and it's treatable with statin. High-dose rosuvastatin actually had dramatic improvement, blow up the curve up in the upper right. Primary endpoint, dramatic, almost a 50% reduction, reaching statistical significance very quickly. So, interestingly enough, very few days after my epiphany of having an LDL of 170 in 2003, this article was published in JAMA. It actually, most of you never heard of it. It's called the Portfolio Diet. It sort of lost a lot of momentum because we were all very interested in avoiding conflicts with industry. And this diet by David Jenkins, the Portfolio Diet, had a lot of plant sterols, viscous fibers, soy protein, and almonds. And unfortunately, it was sponsored by the California almond industry. Okay. But the data is the data, and so I'll show it to you anyway. What he did was take a very good American Heart Association type of diet, but it did have some animal products, low in saturated fat, and then that same diet plus a statin, and then that same diet, then changing the diet to, without the statin, to this vegan diet with a lot of almonds. And the data was actually very impressive that you could lower your LDL cholesterol and your C-reactive protein just as well with the diet as you could with the statin. So what do I do in my practice? Obviously, I'm trying to get everybody to do both. IGF-1 would be the next one to talk about. It's insulin-like growth factor 1. If you're a young athlete, you're trying to make it to the NFL, a lot of this is good for your muscle development, but then what happens at age 50 is a different story. It produces a lot of diabetes, cancer, overall mortality. You get it from eating animal protein, and it has been associated with that mortality, and you don't get IGF-1 from plant protein, and that probably explains some of the mortality difference. So I added this because I remembered that Larson had this. Oh, it must have been 25 years ago. If you're in the back, you can't read it. It says, in sudden disgust, the 3 lionesses realized that they had killed a tofuta-beast, one of the Serengeti's obnoxious health antelopes. I get this question all the time. Where do you get your protein? And it's interesting everybody in the room knows mammalian biology enough to know that cows and horses, gorillas, elephants, they don't eat animal protein, and they get huge. And so it's very normal for a mammal to eat vegetables and get plenty of protein. So anyway, it's more of a joke than anything else. Okay. TMAO, hopefully you're hearing about this. It's probably the next new risk factor. It was published by Stan Hazen in the Cleveland Clinic. talking about eating phosphatidylcholine and showing this very nice graphic of cheese, eggs, and meat going into the body, coming out of the GI tract with trimethylamine that gets converted to trimethylamine N oxide, which produces heart attack, stroke, and death by promoting atherosclerosis. They thought at the time, they've been working on this for a while, they show this relationship between a serum TMAO level and outcome over 3 years, which was tremendously bad. And it's been interesting that they then started to focus on not just what you were eating, but what happens to the bacteria when you eat. Because when you eat animals, you're getting a lot of stuff. Well, everybody knows, you get E. coli and that sort of thing. But the GI bacteria seem to be different. Somehow they convinced first 1 and then 5 vegans to eat a steak. Okay, and when they did, the omnivores had this dramatic increase over a 24-hour period in TMAO levels, and the vegans did not, and that's because of the bacterial conversion. So Stan's idea was, we're going to get some antibiotics and get some benign bacteria and replace them. I don't think he's done that quite yet. The other approach is to just, kind of do like a statin, come up with an enzyme blocker that stops the hepatic conversion of trimethylamine to trimethylamine N oxide. But he's now focusing on the idea that, that they found that TMAO enhances platelet hyperreactivity and thrombosis risk. He's got good data to support that, and so he's hoping that we can actually change these levels in some way. And it's sort of taking over the cardiology, because they actually have looked not just at stroke, heart attack, and death, they're also looking at heart failure. And they found that the TMAO level predicts heart failure outcomes very similarly to BNP. And you get another one of those 4-pronged curves. It's worse if they're both bad. Since I mentioned heart failure, I should mention a very recent, or fairly recent publication that talked about red meat. I know this could have gone back in the red meat section, but we're normally thinking about heart attack, stroke, and death, but there is heart failure data as well, that if you're eating a lot of animal products, it increases your heart failure mortality dramatically, somewhere like over 200%. I should mention phosphorus for all of the nephrology folks in the group, or nephrology minded. You'll know that we all have about the same serum phosphate level, no matter how much we're eating, and it's regulated by FGF1. You eat more, your FGF23 levels go up. And it turns out that FGF23 increases left ventricular hypertrophy, heart failure, chronic kidney disease, and cardiovascular events. And so it's something to be avoided. The more phosphorus you consume, the higher the mortality. Heme iron is one that we hadn't thought of, and I had to throw this in here because of relatively recent publications that sort of dovetail with what we learned from the Finnish Helsinki studies years and years ago, that the more iron you eat, the higher your heart attack rate. It probably isn't just iron. They're saying now that this is actually oxidized iron, or ferric rather than ferrous. And that if you're eating vegetable sources of iron, you're not getting that, but if you're eating animal sources, you're getting a lot of reactive oxygen species, inflammation, instability of plaque, and ischemic events. So something to correlate with the Finnish studies that say that you really should have a lower ferritin level to avoid the increased risk of myocardial infarction. The last one I'll talk about, since I'm at Rush and my chair, the guy who hired me is a nephrologist who's been working on this molecule, soluble urokinase type plasminogen activator receptor. It actually does correlate with cardiovascular mortality as well as nephrology, bad outcomes, progression of glomerulonephritis. And there is some preliminary data saying that if you change the diet, you can change the SUPAR level and put people on the lower curve, the better curve in terms of event-free survival. So there's a lot of data out there, and it keeps growing. I've been focusing on cardiovascular, particularly on mortality, but there's data for a variety of conditions, all of which have been helped by plant-based nutrition. But coronary disease, I would like to officially rename it culinary disease, okay? Because we do have data that we can reduce it dramatically by changing the diet. It's better if you do it for at least 5 years, and you should do it younger than older. People wonder, and there are actually good British studies on bringing up children in vegan environments. They all do very well. Reportedly, the IQs are 16 points higher if you raise your kids vegan. Could be that the parents are smarter, I don't know. Okay. Wouldn't want to close without giving some credit to Caldwell Esselstyn at the Cleveland Clinic, who has done a lot of this regression work for you angiographers. Let me just let your jaw drop for a moment. Okay. This was 32 months of a completely plant-based diet, no statin, no fat in the diet. That's the Esselstyn diet. It's a fat-free diet. And it's hard to explain this, with coronary spasm, et cetera, but, I'm not a big fan of one-offs, but my jaw drops every time I look at it. He did have a series of these, and the plaque was better, but I would like to see more data with long-term outcomes. This is Dean Ornish's data published in JAMA showing angiographic regression with the Ornish diet, which is a vegan diet that is low in fat but not absent in fat. And since I'm in Texas, had to show Lance Gould, okay, who has been doing PET studies at University of Texas for many decades, and this was published over 20 years ago, showing a patient, the blue is bad, for those of you who haven't seen this particular color scale, a lot of right coronary artery inducible ischemia on rubidium done with dipyridamole, and this is actually, drum roll, 3 months of vegan diet with no statin, okay? Just 3 months. And so that sends me back to that Vogel thing about eating animal products, eating a high-fat diet, and decreasing endothelial function and myocardial as well as cerebral, et cetera, blood flow. So we do have data for increasing longevity, and is it that animal products are so bad for you for all the things that I've talked about, or is it that vegetables are good for you? I don't have the answer to that, but I can tell you that we were able to try to get this concept into the dietary eating patterns. It was great to have the help of the American College of Cardiology, and there it is. You have healthy eating patterns, vegetarian diet in our U.S. Guidelines now, and in terms of the dietary cholesterol, the part that we found, they said that we said, don't worry about cholesterol, eat as much as you want, which is completely not what we said. We actually did get them to change it to what the IOM had said, which is that people should eat as little dietary cholesterol as possible. Well, what does that really mean? That means everybody should be vegan. Okay, all right. I want to give credit to the fact that, I'm always talking about how it's difficult to get this word out and difficult to change folks' behavior, but we are getting a lot of traction. The people who adopt this the fastest are people who are the insurance company and the health provider, like Kaiser, and they are really moving into this area because they can save money on both sides. And so you have people like Rob Ostfeld, you have a variety of increasing number of plant-based nutrition folks who are, and this was a really great quote, if the pharmaceutical industry produced a pill that would provide the healing power of plant-based diet, it would be a blockbuster. I think the data supports that. We have had our difficulties being maligned by some paleo-cardiologist who was selling oils in his office and saying that I was influenced by industry because I was at ACC, which is completely. So I take that partly as the, not just being laughed at, then the violently opposed part, the Schopenhauer trilogy. But I think at some point it will be accepted as self-evident. And I thought that I got this 2 days ago, maybe you guys saw this. So I threw it in here because I think it actually does show that people are paying attention. This is JAMA Internal Medicine saying, what are the articles of 2016 that had the most impact in terms of people downloading it? And the middle one, yes, I was telling Bill I had been accused of hiring only women at Rush. It's completely not true. It was 18 to 6 in favor of women, but not completely women. But this might be why all the female physicians tend to have better outcomes, okay? But the other two were actually about the diet. It was the sugars data that I showed you and the animal protein data that I showed you. People are paying attention, and hopefully that will have pay dividends down the road. If physicians are reading it, they're going to change things. All right, so I want to welcome you to Rush. Thank you very much. Come by anytime. We have a wonderful institution that's growing, and we now have 4.75. What is that? So we have 4.75 vegan cardiologists, okay? And so what's a 0.75? I have my director of interventional research, Gary Scher. does a lot of stem cell stuff. He's seeing atherosclerosis all the time. He's listened to my talk. He's looked at the data, and he's vegan until 6 p.m. Okay, so thank you very much.